So, a little bit about me. My name is Tejbir. I'm a junior at Katy High School, and my topic was the physical and neurological impacts of excessive opioid use, specifically on athletes. And the main reason why I kind of researched this is just because I've been involved in athletics my whole life, and even though I haven't suffered from any kind of drug use or anything like that, it's a very big problem in the athletic community. You see a lot of people ruining their athletic careers and everything just because of they're taking opioids or drugs after an injury or something, and it just kind of ruins their whole career because of the side effects. So a little bit of an introduction. My main questions that I kind of answered in my research was, how do opioids impair one's health, and how do those side effects affect their athletic performance? And these are just really important just because according to the National Institute of Health, 5 to 8 million Americans use opioids to manage pain, and up to 19% of that population does get addicted to the opioids, which is a really big amount. And that, although that's more general, looking at athletics and athletes in general, 52% of NFL players use opioids, which is half of the NFL players, or they've used them in their career. And just using those in general makes someone so susceptible to addiction. And some background, our opioids are a class of drugs. They're derived from the opium poppy plant, and they include prescription pain relievers like codeine, oxycodone, and morphine. And they're also illegal drugs as well, such as heroin. And these mostly work by the opioid receptors. They bind to the pain receptors in your brain or in your nervous system just in general. And that blocks out the pain, that blocks the pain receptors from binding, which causes that sense of relaxation and euphoria, and is what makes it such a good pain reliever. So, and although that is really good for pain, the effects can be really severe. So some side effects can be drowsiness, nausea, cognitive impairment, and using it in the long term can lead to tolerance, dependency, and addiction. And overdose can be fatal as well. So some effects of opioids, the neurological effects. Opioids mostly impair the frontal lobe of the brain, which is responsible for things such as movement, communication, reasoning, recall, and memory. Just using those opioids can really stop. If you're a kid, when your frontal lobe is still developing, that can really stop the development of the frontal lobe, which can affect all those things as well. And the usage of opioids has also been linked to multiple mental illnesses such as depression and anxiety. So there was actually a study that showed opioid users and non-opioid users together, and the increase in and the correlation between there was a correlation between using opioids and having anxiety as well. So some physical impacts are, over time, opioid overuse can damage the respiratory system. This happens because one of the main side effects of opioids is shallow breathing. So you're not breathing as deeply, you're not getting as much oxygen into your bloodstream and into your body. And because of that, because of not having all that oxygen come into your bloodstream, it causes CO2 to build up, which can be toxic, and that causes hypoxia. So hypoxia is when your muscles and your tissues and your organs, they aren't receiving enough oxygen in your body, and that causes that respiratory depression, which can cause, in the extremes, respiratory failure and cardiac arrest. So my methodology in this research, it was a literature review, and I researched this to see the effects of opioids and how, just to educate people, because so many people use opioids and they don't understand the real risks and the real side effects that this can cause, because it can even cause death in some extreme circumstances. So I just researched this to show people the effects of that drug and what it can really do to your body. So I mainly use science libraries, journals, and articles from organizations such as Mayo Clinic, the National Institute of Health, to find these finished trials and collect data to support that. This was all done for the purpose of collecting data from previous journals to see how certain aspects of opioid use could potentially affect athletes' performance and health, not only off the field, but on the field as well. So for my literary review, there were a lot of journals, but I tried to like get my main points here. Something that really stuck out to me were a professor at St. John's University said, these drugs make athletes drowsy and confused, leading to a loss in agility, speed, focus, and reaction time. And all those things are necessary for athletic success. Without those, you can't perform properly. You can't really be successful in athletics without those things. And another thing he said were opioids are a depressant, and this kind of goes with like the mental aspect of using these drugs as well. Many athletes get depressed because they're on injury. They can't compete, they can't perform. And so to deal with those injuries, they take those opioids to manage the pain, which is kind of what makes addiction such it makes them so susceptible to addiction. Yeah. And another thing was, according to the Indiana Department of Health, the use of opioids can exacerbate the effects of a pre-existing TBI, which is a traumatic brain injury, and the cognitive and behavioral impairments associated with that injury. So this really stuck out to me just because in sports, some of the main contact sports, let's say like football, wrestling, there's such a high rate of traumatic brain injuries, whether it's like a skull fracture or a concussion. And there was a study showing in 2012 there were about 300,000 football injuries that year. So that just shows how many people really do get affected by these injuries, and taking opioids on top of that can really impair their neurological health. And lastly, I kind of talked about this earlier, respiratory depression. It happens when there's not enough oxygen entering the body. This is one of the main things that happens with opioid use, and that can just really impair someone's health in general. So although there weren't really results, but I did come to the conclusion that these studies show a direct correlation between the increased opioid use and decreased performance rate by athletes. Because using these types of substances excessively, it just causes so much harm to your brain, to the development of your brain, as well as your body, because of it decreases the body's overall function, it can weaken the immune system, and it just really increases someone's risk for injuries and disease. So I just want to talk about my research experience really quick. Professor Kate and Professor Virgil have really been a help. Professor Kate's lectures and tips and her background knowledge really did give me a good base to conduct my research, which helped me a lot. And Professor Virgil really helped me with like writing my paper, and he really strengthened my writing skills, and he taught me how to structure my paper, which just really helped with the flow overall. And overall, this research program, like Gifted Dabber, just helped me learn so much about biology, and it really expanded my knowledge. And I'm just really grateful for that. And that's it.
Yeah, you can stop. Yeah, a record. Yeah, and yeah, I want to thank your dad. Your dad is here, right? Your dad.
I think so. Yeah.
Yeah. So yeah. So Tejbir's older sister was my student as well. She did research and she's gotten into. I can't remember which college she's going now, but she got a lot of good acceptances and wonderful set of parents who are always encouraging of their children. So let's take a moment to thank parents. I mean, without our parents, we wouldn't be here. So thank you, Harmeet. Balaji is also here. If there's any parent here, a big shout out to you guys because of the time and effort that you put in your children. Okay, so I'll have Professor Kate ask you your question.
Mm-hmm. I noticed this throughout the time when people were giving me their topics and everything. But within your topic here of opioid addiction, we've had somebody talk about it with pregnant women. You basically talk about, concussions, athletics, brain injury, use of opioids doesn't help very much. And then you talk about the sports, that too. So what happens to a person, and this is more a social question than anything, if a person has been taking opioids and all of a sudden now we don't have a doctor who will prescribe them, what do they do?
Yeah, so I actually wrote about this in my essay as well. There's so much of like a mental factor when it comes to athletes, which I feel like should be studied more just because their circumstances are so different. Because they want to go, they want to get back on the field, especially recovering from something like an ACL injury, for example. When that doctor stops giving them prescriptions and they realize like, um, and they realize I need to get back on the field, like I want to get back to practicing, I want to get back to competing, I personally think that they might start going and finding those opiates themselves, whether it's just small things like acetaminophen or something, and just excessively using those can still really impact someone's health, even if it's not prescribed to them. Using those in a great amount can really have the same effects as a prescribed opioid.
Too much Tylenol will damage your liver. A lot of people will try to buy the drugs on the pills on the street, and then they get too expensive, and hopefully, but it can happen to anybody. What ends up happening is a lot of these people end up addicted to heroin, and then that brings a whole other big problem. So anyway, again, something that really people are working on it in science, ways, non-opiate ways to safely manage pain. And there's a few companies that are doing that. If you ever want to know more about that, let me know. And I can give you some resources to a very good book I just read and some other stuff as well. So anyway, you did a great job. Thank you so very much.
Thank you.
Yeah, and Tejbir, we are bringing in a new effort is to bring media coverage. Okay, so we have a couple of students who have gotten into media, and my whole team will help you, guide you into how to take this activism further. It's a social cause. So you have opioid, and Sarayu has the vaping, and also Vinita had something else. So we will teach you. We don't want you to stop with just this research paper. Please go to Professor Kate and get those information. You need to get your stats, and we are going to send you, we're going to create a proper Google Classroom and a very structured program where you're going to take this activism further. Okay, like for example, Nived, his initiative is suicide prevention. So he went on Fox 29 News to spread his word. He's been interviewed by other people. He's conducting a march for teen life, okay, in Harrisburg. So you could do a march or something like that to build awareness. And what we in Gifted Gapper feel is teen on teen support is more important. You get it? It's not just teen approaching adults, but teen supporting another teen. And Tejbir, you're going to figure out how another teen can support and speak against opioid. There's a lot of learning and effort that needs to be done. And I just want to know if you are in for it.
Yeah.
Okay, so that will come further once we get out of this very busy college season. Laurie is our other counselor. We will be building a program. We will share with you how to approach media, how to further your cause. It needs to be like a proper cause to bring the kind of attention that is there. Okay, thank you.